want to thank you for following through on this hearing today, and reducing administrative burdens in healthcare is a very important and top priority issue. Our country spends more than $4.5 trillion annually on healthcare. Our spending has more than tripled as a percentage of gross domestic product since 1960. Growing healthcare costs don't just strain Americans' pocketbooks. These healthcare costs also are a major driver of widening budget deficits and the federal government's unsustainable fiscal outlook, and we're not getting our money's worth for all of our spending. Major healthcare program spending eats up 32% of the federal revenue today, and it will be 44% by mid-century. Our healthcare system has plenty of waste and inefficiency, and these ought to be fixed. As I've stated in our previous healthcare-related hearings, we should begin by increasing transparency, competition, fighting fraud, and cutting red tape. Federal regulations are often too burdensome for physicians and healthcare providers. We should promote innovation and competition under Medicare and lessen the focus on central planning. Since 2021, federal agencies have imposed over 90 regulations on the healthcare industry, costing taxpayers and providers over $100 billion. These regulations create 10 million hours of paperwork, hours that could be better spent providing care to patients. This is the opposite of reducing the administrative burden. I'm glad that the Centers for Medicare and Medicaid Services recently took action to improve the timeliness of prior authorizations for seniors that are on Medicare Advantage. I hope this lessens the burdens on providers and improves access for patients. I support putting more sunshine on prior authorizations. CMS should be aggressively auditing Medicare Advantage prior authorization activities so that we have a clearer understanding how the patient, providers, and taxpayers are impacted. Some administrative functions serve an important purpose in preventing unnecessary healthcare spending. The Government Accountability Office and CMS across multiple presidential administrations have created and agreed that transparency and efficient prior authorization plays an important role in combating waste, fraud, and abuse. Cutting down on $103 billion of improper payments for major healthcare programs would be an effective way to lower healthcare spending as well. I'm the author of major and more recent updates to the federal government's most powerful tool in fighting fraud, and that tool is the False Claims Act. Since the enactment of these reforms, the federal government has recovered more than $75 billion lost in fraud and actually saved billions more by deterring would-be fraudsters. In 2023, there was more than $2.7 billion in False Claim Act settlements and judgments, with $1.8 billion of that $2.7 billion involving healthcare industry. Now, we all know that whistleblowers are very responsible for helping recover nearly all of this money that's been recovered. The Justice Department, CMS, needs to be more aggressively going after healthcare fraud, waste, and abuse. We can reduce administrative burdens in healthcare for providers and patients without compromising access to high-quality care. We can get there by reducing regulations while maintaining guardrails to protect patient-centered safety and quality. Through greater competition and transparency in our healthcare systems, will help to bring down costs and lessen administrative burdens. Healthcare spending can be made more efficient without compromising the quality of care or reducing access, especially in rural America. I look forward to hearing from our witnesses today on ways that we can reduce administrative burden in healthcare for patients and providers while lowering taxpayers' costs. Finally, I want to comment on a recent Medicare trustee report. Medicare is part of America's social fabric, and for decades it has provided seniors with disabilities access to routine and life-saving care at their local hospital, doctor's office, and pharmacy. For the 8th year in a row, the trustees have issued a funding warning because Medicare outlays are expected to exceed its dedicated revenue by 45%. Republicans want to preserve and strengthen this program for future generations. The only way to make these critical programs sustainable is to follow the Ronald Reagan Tip O'Neill model of 1983. That means that Congress and the President working in a bipartisan fashion is what it takes to get the job done. I'm proud to have been led the effort in 2003 to modernize Medicare by establishing the prescription drug benefit, Part D. In the first decade of Medicare Part D, the federal government spent 36% less than projected while improving access to prescription drugs for millions of seniors. That effort required bipartisan cooperation from both chambers and presidential leadership, and is a prime example of what we need to do to address Medicare's fiscal challenge. Thank you, Mr. Chairman.